Hi, this is Dr. NIKAM. This is a Sugarland Heart Center presentation on Medicare Enrollment year 2012. Are you ready to enroll in Medicare? You don't know where to start. You can't decide which plan to choose. You don't know who to ask for help. Don't worry. This presentation will give you all the information you need to make a knowledgeable decision about how to enroll in a Medicare program for year 2012. Before we proceed, let us talk about the ABCDs of Medicare. Medicare has several different programs. And these programs are recognized by the letters A, B, C, and D. The Medicare Part A refers to hospital charges. If you go to an emergency room or if you're admitted to the hospital for surgery, the charges submitted by the hospital are processed by Medicare Part A. Here you may have to meet certain deductible and copay charges for the hospital charges. Medicare Part B pertains to physician charges. When you visit a doctor's office, when you get a physical examination, or you get a blood test done, or you get an x-ray or a ultrasound done, these charges are submitted to Medicare Part B. Medicare Part B also has an annual deductible, and Medicare approves certain charges which are called the allowable charges. And based on the allowable charges, Medicare pays 80%, whereas you are responsible for the 20% unless you have a secondary insurance which pays for your deductible and 20% co-insurance or copay. Medicare Part C is a hybrid of the Part A, Part B, and Part D. This is similar to the Health Maintenance Organization or the HMO concept, where Medicare gives a lump sum amount to an insurance company to manage Medicare patients. The insurance company, which administers the Advantage plan, is responsible for taking care of the hospital charges, taking care of the physician charges, taking care of outpatient related charges such as x-rays, rehabilitation, or surgeries, and also take care of the prescription drugs for the patients. And finally, Medicare Part D is for prescription drugs. If you are planning on having Medicare Part B, which is called the traditional Medicare coverage, then you may have to buy a supplemental insurance which covers the deductible and copay in addition to paying for your prescription drugs. Now let's look at the two main types of Medicare enrollments that are available. First, the traditional Medicare. The traditional Medicare has been in existence ever since Medicare came into existence. The Medicare Advantage plan is a more recent one. Let's look at the differences. In traditional Medicare, it is fee for service. When you visit a doctor, the Medicare sets certain allowable charges and pays 80% of that. Whereas with Medicare Advantage plan, the Medicare Advantage plan negotiates a certain amount with the hospital and with the doctors, which is fixed, and it pays a major portion of that negotiated fee. With the traditional Medicare, we have the so-called deductibles and copays. So you have to meet your annual deductible before Medicare starts payments. Similarly, with Medicare Advantage plan, you may also have deductibles and copays. The most important differentiation between traditional Medicare and Medicare Advantage plans is that with traditional Medicare, you can choose any doctor or go to any hospital of your choice. Whereas with Medicare Advantage plans, there may be restrictions as to which doctor you can see and which hospital you can get admitted for your services. Certain doctors who are not on the Medicare Advantage plan as preferred providers may be out of network, and it may cost you more money to get services from doctors who are out of network. Since you have to pay deductible and co-pays with traditional Medicare, you may need a secondary insurance such as AARP or any number of insurance companies which provide secondary insurance coverage for Medicare patients. Whereas with Medicare Advantage plan, you do not need a secondary coverage since the Medicare Advantage plan pays most of the charges that are incurred in a hospital or that are charged in a doctor's office. With the traditional Medicare, you need a separate prescription plan, which could be sometimes combined with secondary insurance so that your secondary insurance and prescription plan become one separate entity. Whereas Medicare Advantage plan is a complete package that covers the hospital, the doctors, and the prescription drugs. However, we want to remember that there are out-of-pocket costs whether you take traditional Medicare or Medicare Advantage plan. The Medicare enrollment begins on October 15, 2011 and ends on January 14, 2012. This is the period during which you decide whether you want to go with the traditional Medicare or you want to enroll in any one of a number of Medicare Advantage plans. Then, between January 1, 2012 and February 14, 2012, you have an opportunity to either drop a Medicare Advantage plan or switch from a Medicare Advantage plan to a traditional Medicare. There are some restrictions here. You can change from a traditional Medicare to an Advantage plan, or you can go from an Advantage plan to a traditional Medicare. However, you cannot change from one Medicare Advantage plan to another Medicare Advantage plan. Here are some of the things that you want to take into consideration when you consider a Medicare Advantage plan. How reputable is a company and how many people are in the plan? If it's a small company with a limited number of people, then the chances of getting services from your physicians may be difficult. You also want to look at what services are covered and what services are not covered. Most importantly, you want to find out if your doctors are on this particular plan that you are choosing. Again, cost becomes an important issue. You want to know what is going to be the charges for an out-of-network service. If you were to seek the services of a physician who is not in a Medicare Advantage plan. Hence, it is prudent to add all the premium costs, the deductibles, the co-pays, and all the ancillary expenses that you incur in a 1-year period and compare them side by side with traditional Medicare and Medicare Advantage plan, keeping in mind that traditional Medicare gives you the freedom to choose the doctor whom you want to see and go to any hospital of your choice. No question, you may be saving some money by going through a Medicare Advantage plan, but you need to keep in mind some of the services that are not covered by Medicare Advantage plan may cost you more in the long run and restrict your ability to choose the doctor of your choice or the hospital of your choice. Here are some prescription plans which are available to you if you were to go through the traditional Medicare plan. The EARP, which is the largest one, which has close to 4.6 million people. Then you have the community CCRX, Humana Enhanced, CBS, Caremark, and the rest of them follow. Here's an important website you need to keep in mind. Look at the web address at the bottom of this slide. When you visit this website, the Medicare website, there is tremendous amount of information available to you. However, you may be overburdened with information overkill. One important point you want to look in the Medicare website is a Medicare Plan Finder. If you put in your zip code and the types of medications you're on and your Medicare number and your date of birth, then it will give you an option to look at traditional Medicare with prescription plans or Medicare Advantage plans with prescription plans and Medicare Advantage plans in various combinations so that you can look at their charges, look at their total premiums, and look at their credit ratings before you make your decision. This has been a Sugarland Heart Center presentation on Medicare enrollment for year 2012, and I am Dr. NIK NIKAM. Thank you for watching.